Hey everyone, welcome back to my channel. In today's video, we are diving into super helpful session for all dental students and NEET MDS aspirants. We will be solving 7 picture-based questions in just 7 minutes, and I will be sharing easy tricks to remember orthodontic appliances that frequently appear in exams. So stay tuned and get ready to crack these image-based questions like a pro. This is a photo of delta clasp. So the delta clasp is used in a twin block appliance. It is a modification of Adam's clasp. It is designed to enhance the retention of the appliance, especially in situations where strong retention is needed. So the key difference that lies in between the Adam's clasp and the delta clasp is in its retentive loops, which are triangular or circular in shape, unlike the open V-shaped loops of the Adam's clasp. Twin block appliance is used to correct class 2 malocclusions that requires retention. The delta's clasp design with its retentive loop is well suited to withstand the forces generated during the treatment. So the key feature to identify whether it's a delta clasp is one, it is used in twin block appliance, and second is to see its loops. It will be either triangular or circular in shape, and that will differentiate it from Adam's clasp. The next is a split labial bow. So the split labial bow is a modification of a short labial bow that is used in removable orthodontic appliance. It consists of two separate short bows, each with a U loop ending distal to the canine. So there will be a U loop that is distal to the canine, and it is activated by compressing the U loops. It is used for anterior retraction in cases where there is a need to reduce the overjet, that is a horizontal overlap of the teeth, in case of midline diastema closure, and in cases where retention is needed. So this is all about a split labial bow. So first you will need to mention that it is a modification of short labial bow. Then it consists of U loop distal to the canine. It is activated by compressing the loop, and then you have to write its uses. Next, over here is a distal shoe appliance. So in the distal shoe appliance, there is a molar band, and over here is the space maintainer. So it is used after the premature loss of a primary second molar before the first permanent molar erupts. It guides the eruption of the permanent first molar and prevents space loss in the dental arch. It prevents the mesial drifting or impaction of the permanent molar. It can also be used in cases of multiple primary molar loss, especially when the second molar is involved. And what are the contraindications of distal shoe is in cases of poor oral hygiene and medically compromised or immunosuppressed patients. So in the distal shoe, the key factor for identification is a molar band, and then you will see a space maintainer. So this is all about distal shoe. Next is a pendulum appliance. So first, by looking at the appliance, you need to describe the appliance. It has an Nance button, then you can see a occlusal rest on your second premolar, and then you can see the molar band and the wire components. Pre-activation is the 90-degree bend that is parallel to the midline of palate. Reactivation is follow-up every 3 weeks. Reactivation done if it is required. Indications: mild to moderate arch length discrepancy, non-extraction treatment of class 2 malocclusions, low to average mandibular plane angles, mesial migration of permanent first molars due to early loss of deciduous molars, second molar extraction cases. So usually in your upper arch we use pendulum appliance to maintain the space, and in lower arch we use the distal shoe appliance. So what are the contraindications of the pendulum appliance? Severe arch-led discrepancy, high mandibular plane angle cases, skeletal or dental open bite cases, and class 2 and class 3 skeletal pattern. So the key identification feature for your pendulum appliance is a Nance palatal button and an occlusal rest on your second molar. Next is the transpalatal arch. So in the difference between the transpalatal arch and a pendulum appliance is the presence of the Nance palatal button, which is present in a pendulum appliance. In a transpalatal arch, it is used as a space maintainer and for reinforcing anchorage. And what is its position from the arch? It is 1 to 2 mm away from the palatal tissue. Indications: it is used to reinforce anchorage, arch with stabilization, to prevent molar tipping, to prevent extrusion of maxillary molars, derotation of molars. Its advantages: it can facilitate force in all three planes, useful in both mixed and permanent dentition. The transpalatal arch is a fixed or a semi-fixed appliance. You can see the molar band and there is no transpalatal button present, and the position from the arch is 1 to 2 mm away from the palatal tissues. Next, this is a cephalometric analysis which is called as Wits Appraisal. So in Wits Appraisal, it assesses the relationship between the maxilla and the mandible. It is used in addition to A and B angle, especially when A and B might be misleading due to cranial base or vertical discrepancies. It measures the linear distance between the AO and BO along the occlusal plane. So after measuring the linear distance, if it is greater than 1 mm, it will suggest that it has a class 2. If it is in between 0 to negative 1 mm, it will suggest the patient has class 1 relationship. If it is less than 1 mm, it will suggest that the patient has a class 3, that is, mandible will be ahead of maxilla. Once the negative is more negative value, that is less than 4 mm, it will suggest that the patient has a severe class 3 pattern. And if it is greater than 3 mm, it will suggest the patient has a severe class 2 pattern. So what are the points in your Wits Appraisal is point A and point B. Point A is the deepest point on the anterior contour of the maxillary alveolar process. Point B is the deepest point on the anterior contour of the mandibular alveolar process. And then over here we have an occlusal plane as the plane of reference. That is a line drawn overlapping the occlusal surfaces of premolars and molars. Then you measure the distance between AO and BO, and then you interpret what kind of skeletal relationship the patient might have. So this is all about your Wits Appraisal. The last one is your buccal canine retractor. It is a removable or a fixed orthodontic appliance that is designed to distally move or retract the maxillary or mandibular canines along the buccal side of the arch. It consists of a buccal arm that runs up from the molar clasp or the molar band to engage the canine. It has an active unit that incorporates a loop or a helix to provide activation and then indications. It is used for retraction of canines after premolar extraction, correction of ectopically placed or labially erupted canines, alignment of the dental arch in crowded cases, and space management for anterior teeth. So if you see a loop and if you see a wire that is around your canine and your premolar, then it will be a buccal canine retractor. So with this, we complete all the 7 different types of image-based questions that are asked in your ortho exams. Thank you.